Hello. Thank you for joining me today. My name is Kristen Fucci, and I am a licensed clinical professional counselor and a licensed professional counselor in Missouri. I'm also a therapist and the clinical director at Resolve Counseling and Wellness. Today, I'm going to speak to you about ethical implications of informed consent. This will provide one CEU on ethics that you can present, and that will be approved for Kansas and or Missouri for your licensure renewal. Thank you for joining us today, and go ahead and get started. Okay, our objectives. Today, I hope at the bare minimum that we're going to work to define informed consent in psychotherapy, that you will be able to understand the ethical requirements for your discipline, whether it be MFT, social work, or counseling. And then, of course, to list the three parts of informed consent. So when we speak about informed consent, what does that mean? What is it? How do I make sure that I'm doing it? The easiest way to get started on that is to simply define it. So we're going to do that next. So informed consent. It is a process that involves the psychotherapist sharing sufficient information with the client or prospective client so that the client can make an informed decision about participation in the proposed course of treatment. So this is the definition, whether you be a doctor, whether you be a medical professional, whether you be a psychotherapist, and any, whether you be a hairstylist, whether you be a dentist, any of those types of things, is that's part of our job, is to make sure that we're getting and giving informed consent to every person so that they are able to make the best decision for themselves. So here are some benefits of informed consent. So with this, we're being able to provide clients with the needed information that reduces their dependence on the therapist and then empowers them to function autonomously. So being able to, like I mentioned before, being able to make the best decision for themselves, and that ability to figure out what they need and if this is going to be the best course of treatment for them. It also promotes collaboration between a client and a therapist. It helps to foster the positive working relationship in which trust and openness is encouraged. So it really begins that level of rapport and the ability for the client and the therapist to have that trusting relationship, to be able to share things that are going well and things that are not going well. And really starts that off in a positive way. As informed consent sets reasonable role expectations and responsibilities, it helps to reduce the risk of exploitation of clients. So as we are sharing what therapy is and how it's going to possibly impact them, one of the things that is also being set up is, what is our role as a psychotherapist? What are we going to do? What is our responsibilities in that, whether that be ethically, legally, therapeutically, within our scope of services, and then reducing the risk of exploitation of the client. So that way the client knows exactly what is expected of them as well. So, regular attendance, if there's going to be homework, what other types of modalities, what is going to happen, what are they expected to do during that time, and making sure that they understand that. It also increases our understanding of proposed treatment by clients, hopefully reduces their anxiety and their apprehension to get started. This also facilitates an informed decision by the client. So when we go into whatever the proposed treatment plan is, we're giving an expected average treatment time, whether in that be number of sessions that could be expected, what is best practice, what is an average length of stay. Hopefully their anxiety goes down. And of course, that the other word would be apprehension. So they feel more comfortable. They know exactly what is going to happen, and they're being able to listen and make the best decision for themselves. Informed consent works to promote ethical practices by ensuring that the client has a right to dignity, justice, and that sense of autonomy. So dignity is a big part of when someone feels respected as an equal in their relationship. Justice, so everybody's hearing the same information, so they know what is best for them, and their sense of autonomy. What is going to be the course of treatment that they feel most confidence in, and being able to speak to what their needs are in that relationship. In addition to the strong therapeutic relationship, it offers the therapist a chance to prevent ethical violations or the legal liability that may occur during the course of treatment. So, excuse me, with this in mind, the things to consider are ethically, what is my requirement? And legally, what am I liable for? And knowing that the ethical violations or the ethical comes directly from your ethical boards or your whether it be the ACA, the Association for Social Workers and or the MFTs, so that way you know exactly what your ethical responsibilities are. The legal liability you want to be able to speak to, because that would depend on the state that you're in. It would depend on your board statutes and regulations. It's also going to depend on your liability insurance. So making sure that you understand all those and being able to make sure that you're covering all those bases before and during any course of treatment with any client. So we're now going to move into the ethical requirements, depending on your background and what your licensure lies within. And just kind of giving you some basics about that. Mind you, these are only the ethical requirements that I'm speaking to are around informed consent. There are many other, of course, pages and different topics that our ethics speak to, but being mindful of that, that's why the links are provided here. Marriage and family therapists, their ethics last time were updated was 2015. Social workers, your ethics get updated as need be or as need comes about. So there are updates to it throughout the years. And then counselors are the last ethics that was updated overall was 2014. So now it's been 10 years. So hopefully they'll be coming out with an updated version soon. So we're going to start with marriage and family therapists first. So 1.2 informed consent in MFT ethics speaks to, as you can see, it's a little bit in light blue. Just talks about what informed consent is and when they need to obtain that. The white sections speak to actually what you need to, then what the content of informed consent is. So these are the things that you would be held to in your ethical practice of sharing informed consent. Okay. Okay. So the content of informed consent may vary depending upon the client and treatment plan. However, informed consent generally necessitates that the client has the capacity to consent, has been adequately informed of significant information concerning treatment processes and procedures, has been adequately informed of potential risks and benefits of treatments for which generally recognized standards do not yet exist, has freely and without undue influence expressed consent, and has provided consent that is appropriately documented. Okay, so for MFTs, things to think about. What are the modalities and standards of care that are recognized? And am I able to speak to those and being able to share that information? Am I able to measure capacity to consent? Am I assessing and being able to say that my clients are here freely and without undue influence? And are they adequately informed of the significant information concerning treatment processes and procedures? So that depends on the practice that you work in. If the agency, they have their own processes and procedures versus just your own, if you're in your own private practice, being able to speak to those, being able to know, also, of course, the licensing board expectations as well, making sure that we're taking those into account. And then also making sure that that the provided consent, verbal and or written, is appropriately documented. Okay. So there's a lot of things in here that have some kind of general, what does appropriately documented mean? What does adequately informed mean? So being very specific for yourself, of how that is shared. And like I said, if you're in your own private practice, I strongly, of course, recommend getting some support on that from either other practicing MFTs and or your liability insurance to make sure that you're meeting all those different standards. So the next one we're going to go into is social worker ethics. So social worker ethics actually has two different pages. We'll go through that real quick so I can show you those. This is 1.03, informed consent. So in the blue, those are general knowledge and things that you should know and or be able to speak to. The white outline is then things that you specifically have to speak to and that you would be held responsible for. Absolutely. So social workers should provide services to clients only in the context of a professional relationship based, when appropriate, on valid informed consent. So that statement alone says you should not be providing any professional related services with a person and or client without getting valid informed consent. That's just what the first part of that means. Social workers then should use clear and understandable language to inform clients of the purpose of their services, risks related to the services, limits to the services because of the requirement of a third-party payer, relevant costs, reasonable alternatives, client's right to refuse or withdraw consent, and the time frame covered by the consent. Okay. So there are many other things listed underneath there. So let's break down that widened section. Clear and understandable language to inform clients of the purpose of the services. So this is verbal and or in writing to be able to not use legal jargon, not use something that is not on the same either reading level and or cognitive ability of your clients to understand, making sure that they are understandable to them. Any risks that are related to the services. So as we know, many times in counseling and with several modalities that different therapists use, there are risks related to receiving therapeutic services. So being able to speak to that, how does that impact them on current and or in the future? Limits to services because of the requirements of a third-party payer. So if there is insurance involved, if this is a person that's getting workman's comp, any kind of victims paying, services that then pay for victims to receive therapy, any of those things that would require you to not keep information confidential, that's something that you would have to speak to. Any relevant costs. So whether that be for court involvement, per session, anything else that is happening outside of session that they could possibly have to pay for, you would want to make sure that you're going over this. Reasonable alternatives. So are there other things that they could do besides actually having that therapeutic relationship with you and developing that? Is there anything else that they could do? And their clients that they understand that they can refuse or withdraw their consent for treatment at any time. So it's not once you start, then you have to stick with us type thing, letting them know that they can stop at any time. And then the time frame that's covered by the consent. Typically, the consent is covered until the end of treatment, whatever they deem that to be. So making sure that you're having an overt conversation about how long your written and or verbal consent lasts. Okay. Other things as social workers for informed consent is on here. We also provide the client an opportunity to ask questions, especially if they are not literate or cannot read that, and we're providing that in their primary language, making sure that we're taking extra time to ensure their comprehension, and or providing verbal explanations or arrangement for interpreters. Instances where clients lack capacity to provide informed consent, social workers should protect their client interest by getting permission from an appropriate third party, and making sure that they understand that and that their best interests are taken into place. Social workers should also take reasonable steps to enhance such clients' ability to give informal consent. Another thing to think about is allowing the client to refuse services overall. Social workers should also discuss policies concerning the use of technology. So I know that some places have a separate informed consent just for telehealth sessions or virtual sessions because of the dynamics and the change in confidentiality and being able to guarantee that. Social workers who use technology will make sure that they are appropriate to use technology for the client's needs and their acuity and their ability to understand the different things that come into play with that. Social workers who use technology should assess the client's suitability, capacity for remote services. If not, then helping them find alternative methods. Social workers should also obtain clients' informed consent before any audio or video recordings of any kind. That for many places is a separate form for a different kind of consent. And then social workers should obtain the client's consent before you ever conduct an electronic search of the client. So exceptions that may arise is a purpose of protecting the client or others from serious, foreseeable, imminent harm. So making sure you're probably having a conversation about social media and those types of things as well. But to know as a social worker, you cannot just go out and search about your client without getting their informed consent first. All right, on to counselors. So counselor ethics get very detailed. And these are things that we need to make sure that as a counselor that you are able to speak to and that you are holding yourself accountable to. So there are 3 pages for counselor ethics. Informed consent in the counseling relationship. Informed consent clients have the freedom to choose whether to enter into or remain in a counseling relationship and need adequate information about the counseling process and the counselor itself. So these are the things that you get to do as a counselor. You have an obligation to review in writing and verbally with clients the rights and responsibilities of both counselor and client. Informed consent is an ongoing part of the counseling process, and counselors appropriately document discussions of informed consent throughout the counseling relationship. So these first 2 sentences simply mean that counselors are mandated basically to review in writing and verbally with clients the rights and responsibilities. So whatever their rights are as a client, and what is my right as a counselor, what is my responsibilities, what's the client's responsibilities, making sure that those are overtly laid out. And then the ongoing part of counseling process. So informed consent isn't just something that happens that first session. It's something that's being discussed and revisited on a regular basis. And then for counselors, making sure you're documenting that each time informed consent is talked about, reassessed, changed in any way. So if you're changing modalities, if the client stops for a month or two or however long and then comes back, making sure that you're having that informed consent conversation again. If they change from in-person to virtual, if there's many other things that can happen into it, if they change from family to individual, or individual to couples, any of those types of things, making sure that you're having another informed consent conversation. So next page. So this is the type of information counselors explicitly, which means clearly and overtly, explain to clients the nature of all services provided. So with that in mind, they inform clients about issues such as, mind you, and this is a short list because it says, but not limited to the following: the purposes, goals, techniques, procedures, limitations, potential risks, and benefits of services, the counselor's qualifications, credentials, relevant experience, and approach to counseling, continuation of services upon the incapacitation or death of the counselor, the role of technology, and other pertinent information. Counselors also take steps to ensure the client understand the implications of diagnosis and the intended use of tests and/or reports. Additionally, counselors inform clients about fees and billing arrangements, including procedures for non-payment of fees. Clients have the right to confidentiality and be provided an explanation of its limits, including how supervisors and/or treatment or interdisciplinary team professionals are involved, to obtain clear information about their records, to participate in the ongoing counseling plans, and to refuse any services or modality changes, and to be advised of consequences of such refusal. Okay, so with this in mind, there's a lot that a counselor is being held responsible to, and all of this should be and could be happening in written and or verbal form. Okay, so making sure that the clients understand certain implications of diagnosis, making sure that they understand what your qualifications are as a licensed professional, what's your overall style or approach to counseling. There's so many things in here. So making sure that you're aware of this. And if it's not happening in writing, making sure that it's happening verbally and or both. So confidentiality, explanation of its limits, to take the clear information that the consequences of refusing services, just like modality changes, all those different things. Okay. Next page. This speaks to making it and ensuring that counselors are developmentally and culturally sensitive with their clients in regards to informed consent. And this speaks to understanding the language and ensuring that they have the comprehension in order to give true informed consent. If they do not have the ability to give consent, and this talks about minors, incapacitated adults, what a counselor then needs to do for the ethical concerns for their licensure, and then mandated clients and making sure that they're giving informed consent in a little bit different way, so that they understand the limits of confidentiality when working with somebody that's a mandated client. And we'll talk a little bit more about that here in a little bit. Okay. Next steps. So what are all of those words mean for MFTs, social workers, and counselors? So ensuring that we are doing a client assessment to make sure that we are covering all the bases required for informed consent. There is required documentation, required written consent forms, and required verbal consents. So making sure that we're meeting all of the ethical implications for all four of those things. So here's client assessment. So best practice. Every client is assessed and is able to give written and verbal informed consent. The client must be there voluntarily and be competent to understand and receive the information given to them in written and or verbal format. Okay. Also, that informed consent is an ongoing conversation. So like I mentioned before, it could be a conversation that you are having anytime a modality shift happens, anytime different people sit in the room, if someone's added to their care team, if someone's taken off their care team, if you change practices and they follow you to another practice, or if you're doing your own practice, that making sure you're having those conversations. Impact on third-party payers and making sure that they understand those things. So those are anytime that happens anytime throughout treatment, making sure that you're documenting that as well. So these are all things that you're assessing as you go. So what does client assessment even mean? So the three things that need to happen in order to meet informed consent is ensuring that it's voluntary, ensuring that they have the competence to understand, and that they're given all the information that they need. Okay. So one of the steps to assess informed consent is voluntariness. So is there any undue influence on a client? Are they there because they even feel like it's best for them, that it's best for a relationship? They drove themselves there. They feel like it's going to be a good fit for them in some way. And this is a hard part, honestly, with minors, because sometimes they are pretty much kind of voluntold to be there. And we'll talk about that here in a little bit when we talk about having minor clients and what does that mean for informed consent. Minors are able to give informed consent. They legally and ethically do not have the ability to do that. And so it's actually the parent or the guardian that's giving the informed consent. And so there may be some influence on someone to be sitting in therapy. But what we hopefully can get from that person then is assent for therapy. So they can see the benefits of them being there and give their assent to be part of the process. Okay. Voluntarily, this kind of impacts our court-ordered clients. They are told many times that they have to receive therapeutic services. The part that's voluntary is they chose where to go, they chose when they come, they filled out their paperwork with the information that's needed. They can see if the benefit is then I don't have to do this anymore, or I can not be on probation anymore. That in itself still says that they're there voluntarily because they are deciding to engage in services. There is a consequence if they don't, of course, but they're taking it upon themselves to engage in services. Voluntary means very different things at an acute level and or hospital level, and we'll talk about that in a little bit as well. So the next part is the competence part, making sure that a client has the ability to make decisions and be held responsible for them. Okay, so this is something to remind ourselves. This is something that first session, making sure we're doing that mental status exam to ensure that their cognitive processes are intact and they're actually able to understand the ramifications of engaging in therapy and or not engaging in therapy and doing what's best for them. So things that would and could impact competence and ability to say that they have the ability to make informed consent is a person's acuity when they come in for therapy. Is that person highly acutely suicidal and or homicidal? Usually that means judgment is askew and they do not have the ability to know what's best for them and or others in that situation in order to keep all parties safe. And so their acuity in that moment might actually impact their ability to give you a competent decision about whether to engage in therapy or not. Psychosis can sometimes skew this, depending on their hallucinations and or delusions and their ability to remain in this reality and in this current person and or self and or world. Um, if they're under the influence of either drugs or alcohol, um, depending, it doesn't matter their prescription or if they're not, if they're recreational drugs, being under the influence of certain medications and or overtaking in them could impact a person's ability to have competency. And then of course, cognitive impairment. So if there is a recent traumatic brain injury, if the person is experiencing dementia or Alzheimer's, sometimes Parkinson's, sometimes other things can impact a person's ability to have the enough awareness to give informed consent. Information is part of that as well. So making sure that when we are doing that, our ethical standards say verbal and written documentation. Best practice would be at the bare minimum to make sure that we're going over the nature of whatever procedure it is or whatever modality we're going to use, risks, benefits, and alternatives. Okay. The next part would be required documentation. So best practice is to document ethical requirements in your initial progress note. So for counselors, that could look very lengthy. Social workers a little bit shorter, and MFTs a little bit shorter. But making sure that you're doing adequate and appropriate documentation. So depending on how your licensing board, your like I mentioned before, getting consultation from others that are licensed in the same states of how do you do this in an initial progress note to make sure that is being done. At a minimum, document that informed consent was covered verbally and or in written format in your initial session with the client. So that would be informed consent shared. For an example, an initial session note versus informed consent, including, counselor credentials, pros and cons of therapy, therapeutic style, all those different things being listed out individually. The reason why documentation is so important, obviously, is because the old adage of if it isn't documented, that means it didn't happen. And that's the way that the court system would look at it, our state boards would look at it. How do we prove that we do things is because we document them. So making sure that you have a really good process and are documenting those in a very succinct, I always suggest, honestly, as a clinical director, very detailed way. So there's no questions to be asked. You're just stating exactly what you're doing every single first session. Moving on to required written consent forms. So best practice, every client is to have a written informed consent form signed prior to any therapeutic services. So that would be a strong suggestion before they even start that first session, introducing yourself or telling what therapy is and getting all their background information, making sure you have that written consent form signed. Mind you, that written consent form should be back to those ethical considerations, understandable and in a concise way so the client can understand it. So it shouldn't be in a whole bunch of jargon. And then at a minimum, if no written informed consent is available, the client's verbal informed consent is clearly documented. And I always suggest getting a second person to verify that. And then the next time you see the person or have them in office, ensuring that you get something written as well, always to cover that as well. Here's the required verbal consent. So best practice. Every client gives their verbal informed consent in the first session when the psychotherapist when verbal ethical requirements are shared. So when we are sharing all that information in a verbal way, we stop to ask, does this make sense? Do you have any questions? Is there anything you would like for me to clarify more? Is there anything you'd like for me to explain in a different way? And making sure that we're having those check-ins throughout that first session. At a minimum, if the client isn't able to give that consent when the psychotherapist, then will receive verbal informed consent by a caregiver or guardian of the client. It's clearly documented and in written format. So, for example, if I have a client that in that first session shows up that is extremely suicidal, they're unable to give their verbal consent. But if someone's with them and or they have a caregiver or somebody with them, I can share all the same things and get verbal informed consent by that caregiver or guardian in that moment. And then being able to obviously get that client to a safe placement somewhere. And then the next time I see them when they're not acute, I'm going over verbal informed consent again. And just being able to share that in different ways. This looks very different, and we'll talk about it here in a little bit with minor clients. So here's a practice question. Which of the following is not one of the core components of informed consent? A, information, B, voluntariness, C, competence, D, signed consent form. Give you 5 to 10 seconds to kind of think about it before I move to the next slide. Have that answer in your head. Okay. Pick the letter for the one that is not the core component of informed consent. Okay, and ta-da! Which one was it? Anybody? So D. D is not required. So the answer is information, voluntariness, and competence are the 3 core components of informed consent. Okay. Information, of course, refers to the appropriate disclosure of relevant information regarding the benefits, risks of a proposed treatment, any reasonable alternatives that could be substituted for the proposed treatment, and the risk then of no treatment at all. Voluntariness refers to that concept that informed consent must be freely given without any coercion. Competence refers to a patient's decision-making capacity. Okay, are they able to make decisions for them, understand the consequences, and be able to be take accountability in those situations? Documentation of informed consent has become an important essential component to psychiatric or psychotherapy practices. And there are 2 ways that we can document it, but is not necessarily required piece of informed consent. Okay, so signed consent form and a note in the patient's chart or in their online documentation or however you document that informed consent discussion was had. Okay, kind of a trick question. All right. So now we're going to have a little bit of Q&A, which of course is different because we're not in person and you're not able to ask questions. But these are 3 general questions that come up whenever I've given this training before about informed consent. So what does informed consent mean for minor clients? Okay. First and foremost, you have to know your state laws of what the age of consent is for different things. And it changes from state to state. Generally, it's age 18 that a person can give their full consent to engage in routine, not acute, um, treatment. So there are state laws that protect, um, a person that is a minor that is trying to get treatment for alcohol drug use, that is acutely suicidal and or homicidal, that for birth control, sexually transmitted infections, different things like that. There are certain state laws that protect things that are commonly shared, but you have to know your state laws. So being in the Kansas City area, making sure you know the Missouri and the Kansas state laws, especially if you are duly licensed. Okay. Understanding where that comes from. So even though the minor is who we are actually treating, they are unable to give informed consent. Okay. So it has to be a parent or guardian that is giving consent. Best practice, especially if they're never married, if they're co-parenting and or have a parenting plan that covers both of them. If a person has any parental rights, um, it is best practice to try to get both parents to consent and give consent for treatment. Okay. Depending on your state, it's not required though, that you only need to have one parent consent to treatment. So making sure that you know that and you understand that. So knowing that a minor cannot give you consent, what does that mean for them? So what we try to get from a minor is assent, which is understanding and their agreement to enter into this therapeutic relationship for whatever motivates them. But so that the way they understand kind of, and we're still going over expectations, what's going to happen in session, what is the different modalities we're going to use, and being able to use it in the language that they understand. Okay. So whether it's play therapy, whether it's narrative therapy, whether it's CBT, it's eating disorder treatment, whatever it may be, making sure that we are sitting down and having a very thorough conversation with the minor, obviously depending on their age and their level of understanding. But even then, even with very young kids being like, being able to come in here and we can just talk about things, or we're able to, as a therapist, I'm able to help assist you in looking at different perspectives or whatever it may be. So making sure you're having the conversation with them. Being mindful of whatever the legal age of consent is, that as we're approaching that birthday, that we're having very overt conversations with the parents and or the minor of how that birth date is going to change the dynamic of confidentiality and how it's going to change the dynamic for informed consent and the ability for this other person to be engaged in their therapy with them to any degree. Okay. So hopefully you're having those conversations in the months leading up to it, actually on the birth date, getting all consents redone, whether that's written, verbal, both. It's being documented. Like I said, it's going to change many different things. Okay. The last thing is making sure that with that change that you're getting ROIs for any person other than the minor and the parent involved in therapy with the minor. And or if when the minor becomes 18 or 17 or whatever age it is in whatever state you live in, making sure that you are then getting ROIs for anybody else that could be included in therapy, which includes payment, transportation, anything along those lines. Okay. So informed consent does look differently for minor clients, but overall is handled very similarly. So one of the things that is noted for best practice is ensuring that one parent, if not both, are present for the first session, so that way all those conversations are happening and shared at the same time. And it's more efficient, but it's also easier to then document exactly what is shared. Okay. Next question. So, how does informed consent work for hospital and or acute admissions? So when I developed this training, overall, it was for those psychotherapists in private practice or having more of a outpatient approach to be able to provide services. So for hospital or acute admissions, it looks different depending on which hospital you're at, depending on what state you're in, depending on what county you're in. It can get very particular uh, and very time consuming, honestly. This is why many times when clients show up with um, undetermined mental status exam, and so they're trying to figure out competency and or voluntariness, that type of thing, they'll honestly usually get placed in a hospital room or in the ER and given 24 to 48 hours to see if there's a change in that mental status exam. So then a person can be there voluntarily and or demonstrate competency to give informed consent. But if not, there's always an ability to get an affidavit from a witness, whether that be somebody at the hospital, whether that be somebody outside the hospital, maybe a roommate, spouse, parent, anybody that could possibly demonstrate and or be willing to give a legal statement about this person's ability or competency. Sometimes people have power of attorneys for medical purposes. That happens sometimes even for children, that if they're living with a grandparent for the summer or they're staying with somebody for a while, the parent can actually give power of attorney to that person for medical purposes to make those quick decisions. Some people that demonstrate difficulties with their mental status have a power of attorney already in place. So it's doing a little research to find that person. Decision-making ability. So this is the big impact for those that are coming in for acute admissions is, are they able to make that decision for themselves, what's best for themselves? And sometimes this can be a temporary thing, and sometimes it can be a permanent thing. So if there's a permanent cognitive impairment, this is going to impact their ability to permanently to make decisions for themselves. And so that's when typically a power of attorney steps in, a guardianship, conservatorship, those types of things. If it's just temporary, that's what I talked about before, that a hospital will wait 24 to 48 hours and give them either medical care or time for their mental status, sometimes to even out, so to speak, or not be under the influence of something, in order to truly be able to give a true assessment of that person's capabilities. So it might just be a temporary thing. So it's something to consider. And then, of course, always knowing your state laws, making sure that you're following your state laws, probably different processes, like I said before, of being able to get that, depending on the hospital you work at, the county you work in, all those different things. So lots of things to consider. Informed consent. So something else to think about is, why does this matter? Right? How can I protect myself more? Knowing like there are board complaints and the legality of informed consent and being aware of that. So one of the things too is always knowing your ethical standards. So there is never an excuse when you are seeing clients, even in an internship, and you're not even licensed yet, you are still held to those ethical standards because you are seeing clients or patients. So you need to know your ethical standards. Okay, revisiting them often. I suggest once a year, rereading those, documenting that you do that. It can be time spent for your CEUs towards your licensing. Honestly, knowing and making sure that you have liability coverage. So if you're not covered through your practice or through an agency or through the hospital, ensuring that you do have your own liability coverage. You can ask questions and be able to bounce ideas off of what best practice is and them being able to keep you in the know. Another thing is to get legal support. Always, 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 always making sure that you have a go-to legal support team or at least person in some regards to be able to figure out what's best and being able to making sure that you are covering um, your safety within your profession, but also for your agency or your own private practice, making sure that you have all that legal support put in place. Having a clear process for every client to include written and verbal informed consent to ensure all clients are receiving the same information. This is a very important part that shows consistency. So if you would ever be called in due to a board complaint and or to a legal situation, you have documentation to demonstrate you've done this with every single client and that this is your typical practice. So if it's not kind of your standard of care, making sure that it does become your standard of care. Okay. So those are just some of the questions, 3 of the questions that have come up when I've provided this training before. So quick recap, best practices with informed care. Know your ethics, know what it is, know what the expectations are. You can never say, I didn't know. That's literally one of the biggest parts of becoming a licensed clinician and or becoming, graduating with your master's and or you choose to go on. But that's something that you have to make sure that you were in the know of. Getting informed consent from every client in writing and verbally. That is best practice. Having a process to gain informed consent, best practice. So everything, it happens the same with every client, no matter what. Knowing your state laws, your statutes, your regulations, and licensure requirements. And then, of course, documentation. Because once again, if it's not documented, it didn't happen. So if there's ever something that comes up legally or board wise, if you're documenting well, you have nothing to worry about. Okay. So those are the biggest takeaways, and knowing what best practices are with informed consent. So if you do have any questions, please don't hesitate to email and or reach out, letting either myself know or we have a wonderful admin team that answers this email. Our website, our phone number, it's all listed right here. Here are some references. Of course, the APA, the AAMFT, social workers, the Code of Ethics are all on here. There's also, if I pulled from any of my slides, these are all some of the, or all of the references that I used. So making sure that you are aware of those and that you can access them whenever you would like to. And making sure that you have those kind of tucked away if ever need be. Okay, that's all I have for you today. I appreciate you taking the time to listen. There will be a quick post test in order to get that CEU credit, and then you'll get a certificate as well. Hope you have a great day. All right, thanks for sharing. Bye.